Faculty Calibration, Module 2, the Extraoral Exam. This module is expected to take 15 minutes. Given the importance of calibration, let's calibrate.
A careful overall observation and thorough examination of the oral cavity and adjacent structures are essential to total assessment before care planning.
Consistency is an important element of any exam. It helps us to keep from missing important structures. Use a standardized, systemic exam technique and ideal palpation. Palpate using the sensitive surfaces of the hand, the tips of the 3 first fingers. There are 4 palpation techniques: compression between fingers on one hand, compression between fingers on 2 hands, compression against underlying structures, compression with movement over underlying structures. Positioning of the patient and clinician is important. For the extraoral exam, begin with the patient seated, hats and glasses removed. The clinician is standing. The recommended exam sequence includes facial, form, skin, and hair, eyes and ears, then parotid glands, occipital, postauricular, and preauricular lymph nodes, followed by the temporomandibular joint, temporalis, and masseter muscle, submental and submandibular lymph nodes, followed by the submandibular gland. The sternocleidoid mastoid muscle includes crevicular and supracrevicular lymph nodes. Finally, the neck and larynx will be examined. Please pause this video and scan the QR code or use the link below to take the next quiz.
You are about to view the systematic sequence and methods used to conduct extraoral examinations. Observe the patient during reception and seating to note physical characteristics such as posture, gait, and facial expression. Begin by explaining the procedure to the patient and obtaining consent.
Begin the exam with an examination of the facial form, skin, and hair. Face the patient and visually inspect all areas of the face systematically, starting at the forehead and ending at the neck. Position yourself behind the patient. Examine the right ear by pulling the earlobe forward and visually inspecting behind the ear. Then repeat to the left ear.
After putting on personal protective equipment, observe the head, face, eyes, and neck. Evaluate the skin of the face and neck.
Now continue to the parotid glands. Stand behind the patient, bilaterally, digitally palpate with one hand on each side, using compression against underlying structures. For the occipital lymph nodes, stand behind the patient with their head tipped forward. Use digital palpation of both hands, compressing against underlying structures. Postauricular lymph nodes, use digital palpation, compression against underlying structures. Preauricular lymph nodes, digital palpation with one hand on each side, using the first 3 fingers, compression against underlying structures. Now let's watch the technique.
Bilaterally palpate the parotid salivary glands. Palpate the pre- and post-auricular lymph nodes. Palpate the occipital lymph nodes.
Please take a moment to pause this video, scan the QR code, or use the link below to test your knowledge. Continuing on, examine the submental lymph nodes. Stand behind the patient. Use digital palpation of one hand on the right with compression and movement over underlying structures. Then continue to the left. Submandibular lymph nodes and glands can be examined in the same position. Stand behind the patient. Use digital palpation of one hand with compression and movement over underlying structures. Use deeper compression for the submandibular glands. Now let's watch the technique.
Palpate the submental and submandibular lymph nodes.
Continuing to the neck, let's examine the sternocleidomastoid mastoid muscle and crevicular lymph nodes. From behind the patient, use digital palpation using the thumb and forefingers of one hand. Repeat on both sides. Crevicular lymph nodes. Use digital palpation and the 3 fingers of one hand, compression with movement over underlying structures, and repeat on the other side. Supraclavicular lymph nodes. From behind the patient, use digital palpation of the index and ring fingers, compression over underlying structures. Now let's watch the technique.
Palpate the cervical chain lymph nodes. Palpate the supraclavicular lymph nodes.
Please pause this video, scan the QR code, or use the link at the bottom to test your knowledge. Neck and thyroid. From behind the patient, bidigitally palpate the thyroid. Place one hand on the right, the other on the left, using the first 3 fingers of each hand. Shift the thyroid from right to left. Place your hand over the thyroid and ask the patient to swallow. Note mobility and size of thyroid during the exam. To examine the masseter temporalis and temporomandibular joint, stand behind the patient. Palpate the masseter and temporalis with the 3 fingers of each hand on both sides. Locate the TMJ using the index finger. Then bidigitally palpate as the patient opens and closes on both sides. Face the patient and watch as the patient opens and closes. Note any clicking, popping, noises, deviation, or abnormalities in the patient's ability to open and close. Measure the opening width with fingers or a ruler. Now let's watch the technique.
Palpate the temporomandibular joints as the patient opens and closes her mouth.
Please pause the video again Scan the QR code or use the link below. There are 3 questions to test your knowledge. This concludes Module 2. Please continue to Module 3.